In this presentation, we are going to discuss Medicare Part A, its coverage, eligibility, premiums, and reimbursements. What is Medicare? Medicare is a government program run by the Centers for Medicare and Medicaid Services, CMS. It is composed of four main parts. Part A provides inpatient and hospital coverage. Part B provides outpatient and medical coverage. Part C offers an alternate way to receive Medicare benefits, and Part D provides prescription drug coverage. To be eligible for Medicare Part A, the patient has to meet any of these five main criteria: age of 65 or older and a U.S. citizen or permanent legal resident of at least 5 years in a row. The patient has to be already receiving retirement benefits, or has to be disabled patient receiving disability benefits, or patients with end-stage kidney disease, or patients with amyotrophic lateral sclerosis, ALS. Usually, beneficiaries are exempt of premium for Medicare Part A if they have worked at least 10 years or 40 quarters total, and if they paid Medicare taxes during that time. Patients who are not eligible for premium-free Medicare Part A can still enroll in Part A, but they have to pay a premium. Penalties can be imposed if beneficiaries delay their enrollment after first becoming eligible. In general, Medicare Part A coverage includes hospital care, limited home health services, skilled nursing facility care, and hospice care. As for reimbursements, the reimbursement rates of different services are set by Medicare. Reimbursement rates are typically less than the amount billed or the amount that is paid by private insurance. Participating providers are physicians who fully accept the Medicare rates. Now, because of the low reimbursements, some physicians choose to be non-participating providers, and these physicians usually do not accept Medicare reimbursements as payment in full, accept Medicare reimbursements for some procedures, and patients might have to pay a bill upfront and get reimbursed from Medicare later. Very few providers, less than 1%, do not accept any Medicare reimbursements. These physicians are known as opt-out providers. In this case, patients who receive services from these providers must pay the entire bill. Medicare will not reimburse the physician or the patient for any portion of the bill, and providers can set whatever fees they choose for their services. After meeting the deductibles, there are some other costs the patient have to pay since Medicare doesn't pay the entire medical bill. Typically, whenever the patient's stay exceeds 60 days, the patient has to pay $329 per day up to the 90th day, and then $658 per day up to the 150th day. If the stay exceeds 150 days, the patients pay the full daily cost. Similarly, Medicare pays the full cost of 20 days of skilled nursing care. After that, the patient pays around $164 per day for days 21 through 100, and then is responsible of the full daily cost if the stay exceeds 100 days.